so much for joining me here today on this Vegan Plant-Based Summit. How are you?
I'm doing great and it's a pleasure to be here.
You've been in this business for over 25 years now. What got you started on this path?
I got started on the path because my father was ill when I was growing up, and he read a lot of Dr. Herbert Shelton's books and joined the Natural Hygiene Society movement back in the 1960s. And then I was a competitive figure skater. I was third in the world in pairs figure skating with my younger sister. And we adopted a healthy diet. Just we thought it would give us better stamina, not getting sick. So I was just always being in competitive sports, just was eating pretty carefully and starting and reading a lot of health books. So my father initially got me interested in it, and then we took it from there.
So you coined the term nutritarian. What's different about this lifestyle choice compared to the normal plant-based diet?
The word nutritarian means you're eating the best foods for your health. You can eat a lot of unhealthy stuff on a plant-based diet and not be comprehensively concerned about getting the wide variety of different types of foods and fibers and nutrients we need. But a nutritarian diet is saying, when you go for nutritional excellence and you try to get a diet that's healthier, you get better outcomes. You get longer life and less dementia in later life, and better health and lower cancer rates, and you age slower. So a nutritarian diet just takes it to the pinnacle of nutritional excellence, because the blue zones around the world are the areas where people generally are living longer, but they're not living that much longer. They're only living an average of 6 to 8 years longer than the average, let's say, American or Western European. So in other words, we can do much better than that. And a nutritarian diet takes that to the limit where we're going to live 20 years longer, in other words, as stupid as this sounds, people want to believe that a diet that's less healthy is just as healthy as a diet that's healthier. How does that sound so ridiculous that a diet is healthier than a diet that's less healthy? But that's the facts. People don't want to. So we're paying attention to eating greens and beans and onions and mushrooms and scallions and berries and flax seeds and chia seeds and hemp seeds and different varieties of mushrooms and different types of green cruciferous vegetables, and having a salad every day and cooked vegetable dish. And so we're doing all the right things, including making sure we're not deficient in anything that a vegan diet might be low in, like DHA, B12, zinc, iodine, and vitamin D. We're making sure we have everything in the optimal ranges and the right diet. And I'm saying that people could say, well, that sounds logical. We're going to eat all these great foods and make sure you have all these nutrients for good health. But I don't want to do that. I'd rather just live a shorter life and not worry about my health so much, just to live a few years longer and enjoy my life more, eating whatever I want to eat. But that's a tremendous myth, because number one, they don't realize that we devise the greatest recipes in the world out of healthy foods. You're not enjoying your food more to make the recipes out of more unhealthy foods. It doesn't taste better to eat white flour than to make something with quinoa. It doesn't make sense to use sugar versus sweetening with a date, or to have it. It doesn't, to fry it in oil, to make a Thai dressing with a Thai curry dressing with nuts and hemp seeds and a little peanut butter. It's not healthier to make it more unhealthy. It doesn't make it taste better. It tastes just as good, and your taste buds get stronger when you're in good health, and you enjoy the food just as much. And the other thing is, when your diet is so rich in nutrients and so comprehensively adequate in all the nutrients humans need, you have a normal appetite. You don't become a calorie-consuming monster, and you don't want to eat more calories than you need. You're satisfied with the right amount of calories, so you naturally gravitate towards your ideal weight. And then you have your full mental faculties your whole life. Because I'm also saying that processed foods and commercial baked goods and diets low in micronutrients and antioxidants make you prone to depression and make you more prone to anger and illogical thinking and addictive thinking and rationalizations. And so you don't have your full mental faculties when you don't eat so healthfully. So yes, so a nutritarian diet is a diet designed to maximize the nutrient intake that humans need to encompass all the nutrients humans need in the optimal amounts. So we're just using modern nutritional science to devise an optimal diet for humans, and then how to make it taste great so people can enjoy it. And for many people, they at least study it, so they know what all the studies are that support this, that make that that demonstrate that we don't have to get cancer as we age. And we can win the war on breast cancer and prostate cancer and colon cancer right now. And you don't have to have heart attacks and strokes. And unique to my message is you don't have to get demented when you get older either. You can maintain your full mental faculties. And that's what I'm absolutely passionate about, because I've been a part of the plant-based and vegan movement for more than 35 years. No, since I'm 68. So I've been since I'm a teenager, right? So I've been doing it for more than 50 years, right? For more than 50 years, I've been part of this movement. And all the people I looked up to and all my mentors and all these people developed in their later years, developed Parkinson's or neurologic problems or dementia. They lived a long time, but they lost their mental faculties because they didn't understand about the things that a vegan diet might be missing to support the brain in later life. So we're doing all the right things to maximize human health, right? So we live to 100 years old in excellent health with our full mental faculties intact.
There's good vegan diets and there's bad vegan diets, and bad vegan diets are mainly full of processed food. I know you say that 70% of the standard Western diet is plant-based, but it's flour and sugar and not the stuff that we actually need, like green vegetables. So what sort of diet should somebody be eating if they're trying to live a longer but healthier life?
Well, I can give you a dietary skeleton to give you a good idea of how I recommend people eat. For example, I have a retreat here in San Diego where people come and spend a few months here when they're overweight or sickly to get well. And I have them have this pattern of eating that they learn how to eat every single day and repeat when they go home. And that is, lunch is always a large salad and a bowl of vegetable bean soup and some fruit for dessert. And the dressings, the salad dressing may change, the type of soup may change, and the type of fruit for dessert might change, but it's still a big salad. It's still a bowl of vegetable bean soup, and it's still a piece of fruit for dessert every day for lunch. And because those raw vegetables are critical and that you chew them very well. And of course, breakfast might be some intact whole grains like steel cut oat or quinoa or kamut or teff with a cup of different types of berries, or wild blueberries or blackberries or cherries or kumquats or loquats or passion fruit or dragon fruit or some kind of fruit with seeds. And we put like a tablespoon of hemp seeds and chia seeds and flax seeds mixed in there with the breakfast. So we have the seeds, we have the omega-3 fatty acids, we have the lignans, so we usually have a fruity breakfast with fruity and seeds and a little bit of grain, maybe some plant milk, like maybe a hemp walnut milk or an unsweetened soy milk with that. And then dinner, we're going to also have some raw vegetables before we start the cooked vegetable dish. With a wok, maybe we're having a cooked vegetable dish with a Thai curry sauce, and the wok might contain snow pea pods and cabbage and different types of mushrooms and water chestnuts and bamboo shoots and and different types of mushrooms and then we're going to have and then we'll have maybe raw vegetables or roasted peppers or raw peppers or raw snow peas or raw bok choy leaves or raw collard wrap with maybe some with something inside of that, but in any case, the dip may be a salsa dip or an avocado, like a guacamole dip or a tahini or a whole sesame seed dip or some kind of delicious dip to put, for the raw vegetables. And then we might have some whipped frozen fruit into an ice cream, like frozen bananas with some macadamia nuts and real vanilla bean powder for a dessert. Or it may be frozen jackfruit that we whipped into a creamy pudding or something. So we're going to have a nice dessert with that too, but it's not going to be made with sugar or honey. We're going to do the sweetener is just from the fresh fruit. And it's amazing how when you're eating this way, your taste buds get stronger, and it's sweet enough to have an ice cream with frozen banana and macadamia nuts and vanilla bean powder. You don't even need a date in there. If we put a little cocoa powder and make it chocolatey, then it's helpful to put maybe one date per person to sweeten it up more, because the cocoa makes it a little more bitter. But most desserts that we're making taste utterly fantastic without using any sweetener except for the fruit or a little bit of dried fruit in it. And your taste buds get stronger for sweets and get stronger for salt when you don't eat it all the time. So the hallmark of a nutritarian diet, though, is that the sauces and the dressings are made with nuts and seeds, not with oil. We're not pouring oil on the foods. We're not cooking things in oil. We're walking in water. we're blanching. And once we walk it in the water or walking it in pineapple juice or walking it in tomato sauce or walking it in, so in vegetable broth, whatever we're walking it in, then we're going to put the sauce on afterwards. We're not going to be putting oil in it and cooking it in oil, because when you heat oil, you form rancidity, you cause free radical formation that causes rancidity and makes these things mildly carcinogenic. They promote autoimmune disease, and they certainly promote obesity and suppress the immune system. So oil is fattening and drives disease. And the food, so what I'm saying right now is that every nutritional scientist and health professional in the world has to agree, because there's no controversy here, that walnuts are better than walnut oil, that sesame seeds are healthier than sesame oil, then pistachio nuts are healthier than pistachio nut oil. It's always healthier to use the whole nut or seed, because they contain phenols and sterols and stanols and all types of beneficial disease protective compounds that you don't get when you take the oil. And also, when you eat the whole nut or seed, like the walnut, the fats are absorbed so slowly into the bloodstream, like 1 or 2 calories a minute. So your body can preferentially burn it for energy. When you take the oil at 120 calories a tablespoon, it's absorbed within 3 minutes. They say from the lips to the hips in 5 minutes flat. And you get so much calories coming in so fast that you can't burn it for energy. You have to store it as fat. And then, because the caloric rush is so strong, there's so many calories coming in at once, they stimulate the apostat in the hypothalamus and drive overeating behavior. So it's nuts because our source of fat, not the oil derived from the nuts and seeds.
So that sounds like an awful lot of food to me, going back to your skeleton model. Some people would actually go, yeah, that's an awful lot of vegetables. That wouldn't fill me up. What about the rice and the potatoes? What's your view on rice and potatoes? Good or bad?
Well, I no longer recommend brown rice because of the studies on the arsenic contamination of rice. And we draw a lot of levels of arsenic in people in blood and urine, and arsenic is a carcinogen. In the United States, they use arsenic to feed chickens. As a chicken, I don't know what they do to make them grow faster, to prevent disease. I don't know why they give them an arsenic in the feed, but they use chicken manure to fertilize the rice fields. And rice takes up arsenic. Brown rice takes up arsenic more readily and like a magnet, more than almost any other food or any other grain. They grow them with a lot of water and they soak up a lot of arsenic. And there's also a lot of the rice is grown on fields where they used to grow cotton. And they used a lot of arsenic-containing pesticides to kill the boll weevil, another type of worm that affected cotton plants. So the Consumer Reports did a study on the rice from China, both wild rice, organic rice, and all the brown rices, and found that the arsenic levels were very high in all these brands. The only time I use rice is when I buy some wild rice from like an Indian reservation where they have these wild marshes, and they knock the rice down in canoes with sticks, and they're not commercially raised rices. So I use other grains other than rice: quinoa, kamut, teff, millet. There's other, and steel cut oats too. So I'm using other grains other than white rice. And then we rate carbohydrates on a hierarchical scale of quality to say which carbohydrate choices have better protection against cancer, are lower glycemic, more favorable for people to try to lose weight, and have slowly digestible carbohydrates that feed that growth of bacteria in the gut. So we're saying here that white rice, even though it has less arsenic, is still too high glycemic. And white potato is not as favorable a food as squashes and carrots and parsnips and beets and beans and zucchini beans and kidney beans and lentils and soybeans. The beans are a better choice of carbohydrate, especially when people have diabetes or are overweight. It doesn't mean a person like me who's athletic and thin can't eat a potato. I can have some potatoes, but my patients that are overweight and sickly, I prefer them to use more beans and less potatoes, because it's much more favorable to their blood sugars. For me, because I'm doing a lot of sports and I'm thinner, I don't have to be as strict as some of they are, but I still don't eat much potato because I want to eat more foods that have anti-cancer benefits. And beans are still a more favorable carbohydrate to promote longevity, and they're also richer in protein as well, which give you more athletic power and strength as you age. And people think that protein doesn't matter on a vegan diet, but that's not what the literature shows. One of the most important findings of the last 10 years in the scientific literature is, yes, plant-based diets were the longest, result in the longest lifespans, and reducing animal protein in the diet resulted in people living longer. But increasing plant protein increased lifespan. And as people on plant-based diets directed their food choices to be plant foods that were richer in protein, they got longer lifespans because people's ability to digest and assimilate protein goes down with aging. And after the age of 80, it could taper off a little bit. And when that means when you're eating broccoli, I'm mentioning high protein foods now because we're including high protein sources. We're not eating a potato or a rice-based diet. We can have some potato and rice in our diet, but our diet mostly is beans and greens and seeds and things that are, the fact that we use nuts and seeds and use hemp seeds and walnuts and sunflower seeds and pumpkin seeds and lentils and split peas and kidney beans and soybeans. In fact, makes the diet considerably higher in protein, and paying attention to protein adequacy is a nutritional advantage for longer lifespan.
So modern lifestyle diseases, they include diabetes, high blood pressure, heart disease, Alzheimer's, cancer, you name it. They've all been linked to diet. Now, animal products, and especially dairy and meat separately, they've been linked to cancer and diabetes, heart disease especially. Can you give us a bit more information on that, please?
Yes, so I'm dividing food into three categories. The three categories are produce or whole plant foods like the fruits and vegetables and beans and nuts. And then one category is processed foods like pasta, bread, salad oil, mayonnaise, donuts, crackers, rice cakes, chips, soft drinks, candy, cookies, and then bread. And then the third category is animal products. Now, I'm saying that a piece of chicken is like a pizza or a bagel because they're both sources of high calorie concentration, but no significant micronutrient load. The chicken gives you a lot of protein, but it doesn't give you phytochemicals and antioxidants and fiber. The bagel gives you lots of carbohydrate, but it doesn't give you phytochemicals, antioxidants, vitamins and minerals and fibers. There's still nutrient poor foods you're eating. So a piece of chicken is like a bagel. You're not getting nutrients that extend human lifespan and slow aging. You only get those foods if you eat colorful vegetables, colorful plants. Now, the chicken is also like the bagel because the bagel is a high glycemic carbohydrate and drives insulin and sugar in the bloodstream too high. And the piece of chicken drives, the protein comes into the bloodstream too rapidly. There's too much concentrated high biological protein. When you're eating chicken, eggs, fish, and meat all the time, you're over-consuming protein, and the body can't turn it into fat that effectively. So what it does with the extra protein is it turns it into growth hormone, like IGF-1, insulin-like growth factor 1. The excess plant protein you ate doesn't get turned into growth hormone because it's not biologically complete. The body has to complete it. So it's not going to complete a whole bunch of extra it doesn't need. But when it comes into the bloodstream already complete in the form of animal products, you get a huge production of hormones production, extra estrogen, extra insulin, and extra IGF-1, which then promotes the growth of cancer and rapidly ages the body. So we can dial the rate at which we're aging, and we can dial up our risk of cancer just by controlling the amount of animal product in our diet. And that's why we notice that we measure the amount of animal product in the diet in people in these long-term studies. And we found that as animal protein goes up in the diet, so does heart attack risk and cancer risk. Both go up accordingly to the amount of animal products eaten because of driving hormones. And saturated fat from animal products also affects the insulin receptor and distorts its shape and makes the insulin receptor not work well. So now when you're eating fatty animal products and you eat a bowl of oatmeal or a mango, your glucose is going to go much higher because the insulin receptor is not going to work from all the animal products you ate. When you're eating a diet of all fresh plant foods and you're not taking a lot of saturated fat from animal products, then your body has an appropriate response to the oatmeal or the mango. And by eating all these high fiber foods that are full of resistant starch and sterols and stanols, you fuel the growth of all these favorable bacteria in the gut that create a biofilm, a thick and you could say disease protective biofilm that covers the villi, that slows the absorption of glucose into the bloodstream. Scientists call that the second meal effect. What the second meal effect means is this, that when you're eating beans and green vegetables and mushrooms and onions, you're going to produce all these beneficial bacteria that inhabit and stay living in your gut. And then when you eat a mango tomorrow morning, the glucose rise in the bloodstream from the mango is low. You're not going to see a big spike in glucose because you were eating your beans, your greens, your onions, and your mushrooms, which then slows the absorption of glucose through the bacteria coating on the villi. It's not even the meal you ate the beans in. It's the meal you ate the next day because you ate beans the day before. So when you're a regular eater of beans, and I'm saying these 4 foods have the most powerful effect at giving you the healthiest microbiome. And there are 2 raw foods and 2 cooked foods. And the 2 raw foods are raw green cruciferous vegetables like kale and bok choy and cabbages and Brussels sprouts. And the other raw food is scallion or onion. Right? They're incredibly healthy to eat those raw onion and raw scallion. And the 2 cooked foods are cooked beans, well-cooked beans, and cooked mushrooms, which are also, those 2 foods are healthier cooked. And the combination of the beans, the mushrooms, and the greens, and the onion and the scallion makes it so now you've lowered the glycemic or hormonal effects of when you're eating carbohydrate foods. So the nutritarian dietary portfolio has a lot of beneficial effects that affects your hormones, and having less body fat on your body also lowers estrogen production too, which of course reduces risk of breast cancer and prostate cancer. So being overweight pumps up estrogen, increasing a male's risk of prostate cancer and a female's risk of breast cancer.
People may say, okay, I can live the plant-based diet and the nutritarian diet, and I can live longer, but is it going to help me to live a quality life? Or should I just carry on eating all the processed junk that I eat and just have, a couple of years less?
Yeah, that's exactly the main point that we want to get across to people, is in the United States, for example, and Western Europe is not that far behind, or England even, and that is that we have the worst healthy life expectancy scores. Meaning that a lot of people around the world may be living to be 75 to 80 years old, but the last 10 years they're alive and they're not in good health and they're not enjoying their life. So we're saying here, so their lives, are they physically fit? Are they able to travel? And do they have their full mental faculties? They lost their creativity, lost their excitement, their passions, their ability to their enthusiasm, their strength, their motivation, their energy. No, they're on drugs and they're sickly. They have no quality of life. We're saying, what good is living to be 100 years old if you're in bad health like those people are eating processed foods and fast foods are. The reason we want to live longer is because we have our full physical and mental capacities. I'm almost 68 and I'm still skiing moguls and playing singles tennis and surfing and boxing and playing basketball and do all the things just as well, just as fast, and just as much fitness and strength as I did when I was in my 20s and 30s. And so the point is you age slower, you enjoy your life more, not just physically, but emotionally and mentally too. And you're not giving up taste. That's the myth. Your taste buds get better. You learn to like what you're used to eating, and it takes time to accommodate your taste buds to change. But you learn the great recipes too that taste fantastic, and you're enjoying it. It's the extra effort it takes to eat so healthfully on this quote nutritarian type diet is worth it because your quality of life is so much better, But it's a good point you're making, because I always say to people, the food doesn't taste so good once you're in the coffin.
No.
But it's not just that. It's that your life isn't that good either. When you're eating like other Americans or other Europeans, you look at people when they're 65 years old and older. They're old people, you know.
Do you think the West is a nation of addicts, but not necessarily drug addicts or addicted to alcohol or tobacco, but junk food addicts?
Yes, we're all addictive addicts because sugar is an addictive substance and white flour is sugar. Let me say that one more time. That sugar, honey, and maple syrup are absorbed into the bloodstream with a spike that affects dopamine centers in the brain in the same areas they are stimulated, that opiates stimulate. And it drives overeating behavior. And it drives dopamine insensitivity, which makes you eventually crave more calories and crave more concentrated calories and want to eat more than you need. So all people that are raised on sugar products, and I'm saying there's no biological difference to the brain or to the body when you ate white flour, a piece of bread, Italian bread, bagel, white bread, croissant, muffin, pizza, cake, burger bun. That white flour is exactly the same as eating a cube of sugar or a piece of candy. You know, there was an English study that showed people with the highest candy consumption the first 10 years of life had a 60% chance of being arrested for violent crime or drug abuse by the time they were 40 years old. In other words, the highest amount of drug abuse or criminality was in people who ate the most sugar in their childhood. Unbelievable. It's unbelievably studies that are replicated now to show that more fruits and vegetables, beans and nuts in childhood makes for more educational achievement, less emotional ability and dysthymia and depression, and more financial and emotional success. And more candy and fast food, including commercial baked goods, because commercial baked goods is candy. Fast food, commercial baked goods, and candy don't just create diabetes and cancer, they destroy your brain in the process, and they ruin your life, your intelligence, and your creativity.
So do you think that the people that have been raised on plants, they don't form an addiction early on, so they're not going to form addictive behaviors as much later on, so they're less likely to end up in prison or with anger issues or depression even?
If they're raised on healthy plants and not raised on junk food, because there was another study coming out of England where it showed that vegans from England had higher hip fracture rates, reduced muscle strength and muscle and bone density compared to non-vegans. And when I tracked the diet that was eaten, and most of the vegans in the study, they were not eating a good diet. And I compared it to a nutritarian diet that's also plant-based. And the diet these British vegans were following had half the amount of calcium and half the amount of protein and half the amount of phytochemicals, because the diet was so high in processed grains and oils, so many wasted calories on oils and processed grain and white rice and stuff like that. They weren't focused on high nutrient plants. So I'd have to say the answer is it depends on how healthy the diet is and how good their choices were. And I'm saying also that, you know, beans and nuts and greens are not optional. They're essential foods to be healthy.
So how does our diet affect depression? Because we've got an elevated level of depression and mental health issues in the West at the moment. I mean, it's been growing over the last few decades, but it is linked to diet. But how would you say it's linked to diet?
I wrote a book on that called Fast Food Genocide, one of my most favorite books that I had written. Not one of my best-selling books, by the way, because my best-selling books are always books about, you know, people want to lose weight and get healthy, but Fast Food Genocide it's one of my favorite books intellectually, but not, of course, didn't sell as well as my other books. But in any case, it's all about how what you eat affects the brain, and the fact that that when you're eating these low nutrient, or when your brain is getting in spikes of glucose and not getting enough antioxidants, you have a higher risk of developing major depression. And even people having fast food or commercial baked goods, even 2 servings a week, doubles the risk of lifetime depression. But I'm saying right now is that the people that don't become depressed, that are eating unhealthfully, it still affects their brain negatively. So they have more dysthymic. They're less passionate and excited about life. When they wake up every day, they're not, excited about what they're doing, and they're not driven, to appreciate the world around them. And they're still somewhat dysthymic. And the word dysthymia refers to not being so depressed, but not being excited about your life either. You're kind of like just living life to make money so you can go eat food or buy or go drinking or go take drugs or something. And what you're saying, it's the last 100 years. 100 years ago, 1 in 500 Americans had mental illness. 1 in 500. Now it's 1 in 5. 1 in 5. And I'm saying that's mental illness, but also half the population is somewhat mentally, emotionally, and intellectually impaired because of their poor diet. They're not the people, they don't have the intellectual capacity they could have had if they had been living on a healthy diet, because there's so much junk food eating and improper food eating. And that's what the book Fast Food Genocide is about. It's big percentages of populations have lost their intellectual capacity, their ability to weigh evidence and think logically, to be compassionate, and project present activities and how it's going to affect the future world, or your own future. Their whole ability to think has been curtailed by their poor diet. And we can see how it's affecting the political climate and possibly even destroying humanity and negative effect on the world. So what I'm saying right now is fast food, junk food, and unhealthy eating affects the way people think and affects their propensity for compassion, kindness, intelligence, and creativity.
Talking about the future, how would you say diet affects unborn babies when the mother's carrying them? Does the mother's diet affect the baby? Does the baby then carry those tendencies over in its life? And for instance, if she eats a high sugar diet during a pregnancy, will the child want high sugar?
Not only that, but even the diet the woman's eat before she conceives the baby, before her pregnancy, affects the health of her children. Our study came out last month showing taking Tylenol during pregnancy increased the risk of autism. Did you see that one? What you do before the baby is born affects your children. The number one cause of death in babies and children, other than accidents, is acute blastocytic leukemia. And that's linked to the consumption of luncheon meats and nitrates in the diet. Not just during pregnancy, even 2 years prior to conception, it affects a high intake of hot dogs and sausage and bacon, increases the risk of childhood cancer in your offspring because the eggs are in your body your whole life. And the lack of green vegetables in the diet before you even get pregnant affects the negative outcome on your health of your children. And you know how the craziness of the health professionals today try to get women to take folic acid pills because they don't want to have neural tube defects. But that's because they're not eating folate. Folate is you're not low in folate if you're eating green vegetables and beans. It shows that people aren't eating green vegetables. Instead of telling women they have to eat green vegetables, which would then protect against childhood cancers and brain tumors and autism and all these and autoimmune conditions, instead of telling them to eat right, they just give them a pill to take. So now they think they can still eat wrong. We're completely backwards with everything that medical profession does. They look to give people a pill, a remedy, a shot, something, as opposed to getting rid of the cause and have them eat right, which could have stopped the problem to begin with. But it's always the solution is always a pill that we can sell to somebody instead of just eating right to begin with. What I'm saying right now is that folic acid pills are linked to breast cancer, are not the same thing as getting real folate, but from eating green vegetables. And women of childbearing ages have to eat green vegetables regularly to have healthy children and not think they can just not eat greens and take a pill instead. It's craziness. And I discuss this in my work a lot about how this pill and remedy mentality and how important green vegetables are to the normalcy of our species. And if you're not going to eat green vegetables and you don't want to eat green vegetables, you better live close to a hospital because you can't have a normal life.
I'm glad you mentioned that, because I come across a lot of people that they want the tablet, they want the potion, they want the quick fix solution, and diet isn't something that they can do right now to flick the switch. But the more, for instance, with diabetes, the more they give you metformin, the more your body, it can't adapt. It just switches off dopamine receptors, and it's just a bad thing. How do you feel about that?
My career is based on trying to educate and motivate people to make the necessary change to get well and get off their drugs. And to my mantra for a person with diabetes is to tell people, don't treat your diabetes, don't control it, get rid of it, become non-diabetic. And when people come to see me as their doctor, I say, what are you doing here? Do you want to get the reason to be here is to get the person who wants to be totally well, to get rid of their high blood pressure completely and get back to normal, to lose all their excess weight, to get rid of their diabetes, to get rid of their headaches, to get rid of their bowel inflammation, their bloating, to get rid of their asthma, to get rid of their psoriasis, to get rid of their lupus and fibromyalgia. In other words, my excitement and passion for what I do is telling people, don't be satisfied with being sick. You can get totally well. And these drugs are just going to keep you sick for the rest of your life. They're never going to, by putting poisons in your body, you can't buy good health. You have to earn it with excellent, with superior nutrition and excellent lifestyle habits. And we can get you back to normal again naturally. So you never have to be addicted to doctors. People think doctors are their savior and the pill is going to save them. And it's just a false ideology. It's almost like a religion where people have a belief system that doctors are going to save them. And they don't, because we can see that even cholesterol-lowering drugs, we still have the same amount of people dying of heart attacks, mammograms, chemotherapy, the same number of people are dying of breast cancer, the same ages. What the medical profession can do is relatively minor. If we the major changes, if people want to really protect themselves, it has to be cleaning up our environment, lifestyle, diet, and personal responsibility.
And what can we do, just before we go, what can we do to protect our children and our grandchildren from this disease of the sugar addiction that we've got and this lack of vegetables problem that we also have?
Well, those foods, they're not foods, they're chemical like drugs, and they shouldn't be in the houses. And if you're going to feed your children junk food or not going to nurse your children or whatever, you shouldn't be having children. But what about all the people consuming all the animal products that are going to destroy the earth with global warming and climate change? And your children and grandchildren are going to maybe half the world will be starving because there won't be growing enough food to feed everybody. And there'll be so much pollution and smoke around that there's going to be a high rate of cancer, even if they eat healthy. There won't be enough healthy food to eat. So we have to people have to, we're in an emergency situation right now. It's an emergency. And the whole world has to switch plant-based pretty quickly for the health of ourselves, but mostly for our children and our grandchildren and for the health of the planet, because we're destroying the planet with all this, with taking down the rainforest and cutting up all the trees and burning and putting the black soot in the air. And so because it's not just, petroleum-based fuels. It's also animal agriculture that's also destroying, accelerating the death of our planet. So we have to think of course, ourselves individually, to have compassion for ourselves, and also to think about our compassion and thinking for other people and other people in future generations. The height of selfishness, right? And we know how much selfish and narcissism went on in American government and American political system right now. And that's happened in prior years, especially with Trump as president. We had a narcissistic president, exciting the people with short-sighted thinking with narcissistic and racist population. And now we have the remnants of that, where people are afraid to, are afraid to face reality and have the compassion for when we're not around anymore, what's going to happen to people that are inhabiting the earth, 20, 30, 50 years from now. We can't just destroy it now and hand a destroyed earth onto people in future generations. That's narcissistic too.
Do you think that this lack of respect for life in general and the environment and animal life comes from this, this mental capacity that we've established for ourselves through the diet? Do you think we just don't care anymore?
I exactly, what you just said is what I'm kind of like expressing in fast food genocide and things, but nobody thinks like that. And they think that we're kind of crazy suggesting that. But I think that is absolutely true, that the junk food diet people are eating has an effect to affect their personalities, to make them an addictive personality, And that combined with a lot of other socialization factors and religious socialization makes people unable to weigh evidence and think logically. They just want to hold on to fixed beliefs and look for instant gratification. And they've lost their neuroplasticity to be able to solve problems, and to think out of the box and to think long term, or to think to benefit other people. I absolutely think the unhealthy diet has exacerbated that. And that's what we're, and I'm thankful for the work you're doing, and hopefully we can move some people in the right direction. If we're going to have to move a lot of people, we have to move millions of people to think differently if we're going to turn this trajectory of problems that are facing the earth.
I could continue talking to you all day because you're so interesting, and the knowledge that you have on this subject is just phenomenal. Is there anything that you'd like to add to the conversation before we leave?
Not particularly. My message is always, if you have some medical ailment, health problem, don't give up. If you're overweight, don't throw in the towel. Don't check out because you failed in the past. You failed because you didn't get the best information. Move forward. You can get well, and you can get your health back, and you get your weight back, and you can become a role model for other people. And you become a passionate representative of what's right in the world. And so don't give up. Move forward, take great care of your health, and get things done that can benefit others as well. And so I hope people come on board, join, start taking great care of their health, and work together to benefit humanity. So happy for people that are listening, participating, and getting involved.
Thank you, Dr. Fuhrman. It's been absolutely amazing. Thanks for being here with me today.
Okay, pleasure. Good luck to everybody.